Hey there, I'm Professor McBride, labor nurse, OB instructor, and your guide to everything OB. Let's get to it. HELP is an acronym for a syndrome that affects pregnant and postpartum moms. It is characterized by three key factors: hemolysis, elevated liver enzymes, and low platelets. HELP syndrome is considered a probable variation of preeclampsia. So a mom can have preeclampsia and not have HELLP syndrome, but if she has HELLP syndrome, she is considered to be severely preeclamptic. So let's look at how HELLP syndrome differs from traditional preeclampsia. Lab findings are going to show significant hepatic involvement. She may or may not have elevated blood pressure. We might not see those severe range pressures that we see with preeclampsia. She may or may not have proteinuria. Right upper quadrant and epigastric pain are going to be the most common symptom for her. And although preeclampsia can have mild or severe features, HELLP syndrome is always considered severe. So looking closer at some of the lab value differences. With HELLP syndrome, you can see a low hemoglobin and hematocrit, an elevated LDH, and a high bilirubin. And all of those are related to the hemolysis or the breakdown of the red blood cells. And those values tend to be pretty normal with preeclampsia. Thrombocytopenia can be seen with both, however, more pronounced with HELLP syndrome. And the elevated liver function tests, the AST and the ALT, can be elevated with either one, but again, tends to be higher with HELLP syndrome because of the significant hepatic involvement that's going on. So when we think about what we might see, our signs and symptoms, the primary symptom we'll see is the right upper quadrant or the epigastric pain. The mom may complain of malaise, nausea and vomiting, or headache, and these are all kind of vague symptoms that could be mistaken for a viral illness. She may or may not have proteinuria and elevated blood pressure, and she will have the lab values that show hemolysis, elevated liver enzymes, and low platelets. Severe manifestations related to HELLP syndrome. We are very concerned about maternal morbidity with this condition. The liver can rupture and hemorrhage into the abdominal cavity. She can also have a hematoma form on the liver that can be bleeding. It can be complicated by eclampsia as well. There's an increased risk of placental abruption and therefore a risk of DIC. She may need transfusions of red blood cells and platelets. It affects the fetal growth, and the deterioration can be very rapid, which often leads to preterm delivery as well. So what needs to happen for a mom with HELLP syndrome? She should get magnesium sulfate for seizure prophylaxis, and the blood pressure should be managed the way we would with another preeclamptic patient using labetalol, hydralazine, nifedipine, and keeping those blood pressures under control. Delivery is the only effective treatment for HELLP syndrome, and expectant management is not an option at any gestational age. So if she is hemodynamically stable and greater than 34 weeks gestation, it is indicated to deliver. If her cervix is favorable, a vaginal delivery is the delivery of choice. However, cesarean may be needed. If the thrombocytopenia is significant, she may not be able to have spinal anesthesia or epidural anesthesia and may require general anesthesia. If she and baby are stable and she is less than 34 weeks, it may be considered to administer betamethasone and wait to deliver for 48 hours if they remain stable in order to allow for fetal lung maturity. If there is a hematoma on the liver, they will watch this for up to 6 weeks postpartum to make sure that it stays stable. And if it is not stable, surgical intervention may also be necessary to treat that as well. For the baby, the prognosis is largely going to be dependent on gestational age when the baby's born. So to review, HELLP syndrome is characterized by hemolysis, elevated liver enzymes, and low platelets. Symptoms include hepatic symptoms, so right upper quadrant or epigastric pain, preeclampsia symptoms, so headache, hypertension, and proteinuria, and nonspecific symptoms like nausea, vomiting, and malaise. Management will include preventing a seizure and managing the blood pressure, monitoring and managing liver involvement, and delivery is always indicated regardless of gestational age. Thanks for watching. Be sure to subscribe, like, and share for new videos every week about everything OB. See you soon.